Hi, I'm Dr. Erin Hunt-Carter. I want to share a little bit about how we approach issues related to body size at Great Lakes Mental Health. I love working with clients in bigger bodies. It's one of my favorite things. Personally, I've been fat for my entire life. Sometimes smaller, sometimes bigger, but always plus sized. If you're in a plus size body, you may have had experiences with healthcare providers who don't do the best job navigating issues around weight. I've had these experiences firsthand, and I hear about them all the time from my clients in bigger bodies. Great Lakes Mental Health works from a health at every size perspective. That means that we believe diversity in body shape and size is natural, normal, and beautiful. We reject the idea that thin bodies are best. We believe that restrictive dieting is harmful, both physically and psychologically. We do not operate from the assumption that your body needs to shrink before you can have a meaningful, happy, healthy, joyful life. Many people come to therapy carrying the belief that their lives will begin after they lose weight, after they feel accepted, confident, or worthy enough. But the thing is, I've worked with many clients who've lost large amounts of weight, and they end up feeling exactly the same, just in smaller jeans. So instead of working on transforming body shape or size, I help clients transform their lives. My goal is to help you start living your best life now in the body that you have today. Our work is grounded in the best available science. Despite what we're often told, restrictive dieting is not supported by research. Diets do not lead to sustainable weight loss, and over time, they actually increase the likelihood of weight gain, weight cycling, and psychological distress. Without surgery, only around 5% of people can lose a significant amount of weight and keep it off for 5 years. The number is much lower than 5% if the weight loss is more than 20 pounds. Diets are a trap. They don't work, and when we fail at them, we tend to blame ourselves. Then we feel terrible about ourselves, and we often end up gaining a few more pounds than we originally lost. Rinse and repeat. The cycle is not fun. That's why we don't help people lose weight. We help people live better lives. Our therapists are knowledgeable about the real barriers faced by people in larger bodies, including stigma, discrimination, and medical bias. Many clients have complicated relationships with food in their bodies, shaped by years of dieting, shame, and misinformation that blames them. In therapy, we work to gently untangle that. You can expect support in developing a more realistic and compassionate body image, letting go of rigid ideas about good and bad foods, and learning to trust your body again. We believe that people should eat a wide variety of foods. And get this, they should enjoy them. We also value movement, not as punishment or a requirement, but as something that supports well-being. We use a joyful movement framework, meaning that movement should feel accessible, sustainable, and aligned with what you actually enjoy doing. And if you're not ready for that yet, that's okay too. Some people do experience changes in weight as their relationship with food and movement heals, but that's never our goal. The goal is feeling more at home in your body and more present in your life. At Great Lakes Mental Health, we believe that you deserve respectful, affirming, science-based care, no matter what size your body is. Thanks for being here.